Alright, hello all, this is Dr. Alsop, and in this dissection supplementary video we will be discussing the pertinent mandibular structures for the mastication session. And the mandible is obviously quite important in terms of attachment for muscles that play a role in mastication, and this is the movable bone of the temporomandibular joint. So we have a lot of fun things to discuss here, so let's get started. Now we are going to be focused primarily on the ramus portion of the mandible and the structures located on the ramus. So let's remember where the ramus is. Now we are looking at a lateral view of the mandible in this image. So this is going to be anterior. This will be posterior. I knew this was anterior because the teeth are going to be anterior. And so if this is posterior, the ramus of the mandible, which is this vertical portion of the mandible, will be more posteriorly located. The body, if you recall, of the mandible is going to be this horizontal portion. So ramus is vertical, the body will be horizontal. So you'll have one body of the mandible and two rami, and you can see a little bit of the other rami over here. The angle of the mandible is going to be where that body and the ramus meet up, and it's going to be this most posterior inferior portion of the mandible. And I want you to try to palpate your own angle of your mandible. So kind of go back to the most posterior portion but also inferior portion of your own mandible, and you should feel your own angle of the mandible. So that can kind of give you an idea of where the other structures are located. Now, the ramus of the mandible is very important in terms of attachment sites for the muscles of mastication. In fact, all four muscles of mastication will have some form of attachment to the ramus of the mandible. So let's talk about the coronoid process, which is one such process. So this will be, and I'll kind of draw an arrow, the coronoid process. This one will be the more anterior process of the ramus of the mandible, so the one that is going to be closer to the teeth. And this will be one of the distal attachment points for the temporalis muscle. So your temporalis muscle is going to attach over here. And other than the fact that this process is more anterior than the condylar process, which is going to be over here, the coronoid process is going to be more pointed, as you can see fairly clearly right there. And it doesn't have the smooth articular surface that you have on the condylar process. So anytime you have a joint surface, you will have a notable smooth surface where articular cartilage was located during life, which is very important in terms of joint function. So as you might have guessed, the joint that this condylar process plays a role in is the temporomandibular joint. So this is going to be the mandibular portion of the TMJ. This pinched in area right here, this pinched in portion of the condylar process, will be the neck of the condylar process. And in between the condylar process and the coronoid process will be the mandibular notch. So this notched in portion right here, literally between those two projections of the ramus of the mandible. And you'll often see the masseteric neurovasculature that passing over the notch in order to enter the deep surface of the masseter muscle, or the masseter muscle, however you want to pronounce it. And that masseter muscle will be located on the superficial surface of the ramus of the mandible. All right, now let's get our bearings as to what we are looking at here, what type of view. This is going to be a hemisected mandible, meaning that the mandible has been cut in half, and we are looking at a medial, or the internal portions of the mandible. And arguably one of the most important structures of the mandible for any dentist is going to be this region right in here, which is the mandibular foramen. And it is here that the inferior alveolar nerve, or your IAN, which is the afferent supply for the mandibular teeth, is going to enter into the mandible. Now projecting kind of into the region of the foramen, or the anterior portions of the foramen, is the lingula of the mandible. So this is where that lingula of the mandible is located. This structure can be palpated as it is such a sharp, noticeable projection in instances where you're trying to guide the anesthetic IA in blocks. The lingula is also the attachment site of the sphenomandibular ligament. All right. Moving back towards the condylar process, which is over in this region, let's locate the pterygoid fovea. And fovea just means small fossa. So that pterygoid fovea is going to be on this anterior portion of the neck. It is a depression right in there, so a small fossa there. And it is called the pterygoid fovea because the inferior head of the lateral pterygoid muscle will have a distal attachment here. So this depression right in this area will be the pterygoid fovea. Moving anteriorly and more towards the coronoid process, you can see this notable depression right in this region. And this is the retromandibular fossa, the retromandibular or the retromolar fossa. Sometimes you see it referred to as the coronoid notch, so sometimes it's going to be seen as the retromolar. And the reason that it is sometimes referred to as the retromolar fossa is because it is just posterior to where the third molar would be located. In fact, the third molar would be right about here-ish, because this is your first molar and your second molar. This would be the third molar. So it is just posterior to that third molar, and that relationship between the fossa and the third molar is important. Because there's some important vasculature located around this area that people need to be aware of with third molar extractions. The temporalis muscle will often have some tendon that extends into this area as well. Okay, lastly, this region right here, this crest portion, is referred to as the temporal crest. I just wanted to make this cursive and be fancy. So the temporal crest is named because the temporalis muscle will have some of its distal attachment or part of its tendon extending into the temporal crest region. So it'll extend a little bit. It'll have attachments on the coronoid process as well as down to the temporal crest and a little into the retromandibular or retromolar fossa region right here. All right, so that wraps up the wonderful world of the ramus of the mandible. I hope you're really beginning to appreciate its importance in terms of the temporomandibular joint, as well as a site of attachments for the muscles of mastication. Thank you for your time and attention.